to be able to suggest new neuroprotective therapy, we will need to better understand like what mechanisms underlying status epilepticus consequences. We did a prior work on the impact of lipids in the brain, of cholesterol in the brain, and status epilepticus consequences. We observed that when patients have an accumulation of cholesterol in the brain, that can trigger neuronal loss and post-status epilepticus epilepsy. But these results have been observed in animal model in which we increase the concentration of cholesterol in the brain. In parallel, we noted that for patients, we also have an increase of the concentration in the brain, but we don't know for sure if this increase is able to induce status epilepticus consequences. So we performed a trial in a mouse model of status epilepticus, in which we decrease the cholesterol concentration by Simvastatin. And we observe that for these animals, you have like less severe consequences with less inflammation and less hippocampus emerged seizures. So that should allow us to suggest that the increase of concentration of cholesterol in the brain is leading to status epilepticus consequences. And so if you prevent the accumulation of cholesterol in the brain, for example, with lipid-lowering drug, you can prevent status epilepticus consequences. So this is the first possibility. And the second possibility will also be to investigate like the impact of immunotherapies administered during the acute phase of the status epilepticus to prevent long-term consequences. So some works have already been published on this subject, and currently the results are mostly conflicting. While some studies explain that if you administrate very early an immunotherapy during status epilepticus, you can prevent long-term consequences. Other studies did not find a clear correlation between the administration of the treatments and long-term consequences.